Thank you very much for coming to this symposium today entitled Advancing Age-Friendly Environments in Low and Middle Income Countries, Challenges and Opportunities for Promoting the Age-Friendly Agenda. I am Thiago Eric de Sá. I'm the responsible officer for age-friendly environments at WHO headquarters, which includes the coordination of the global network for age-friendly citizen communities. And I have the pleasure and the privilege to have with me here a very outstanding set of distinguished panelists, which I will introduce in a minute, as well as the presence of my WHO colleagues, Suvaji Good from the Sierra region, and my colleague Rick Brown from the WHO country office, that I would like to invite Richard to the brief opening remarks of this session today. Rick, please.
So thank you, Tiago. I was just motioning because we have Dr. Olivia and Gao from WHO Thailand as well. On behalf of WHO Thailand, as well as our regional offices and headquarters, I'd like to start by welcoming you to this meeting, or this symposium on advancing age-friendly environments in low and middle-income countries, challenges and opportunities for promoting the age-friendly agenda. In fact, I would just like to mention as well that the WHO representative, Dr. Jos van der Leer, unfortunately could not be here, which is why I'm stepping in. I normally work on health emergencies. But I'd also like to acknowledge and welcome our panelists, who I expect you probably know, but you would, I'm sure, acknowledge that they represent a diverse range of stakeholders, all working towards making low and middle income settings more age-friendly. As you also know, fostering age-friendly environments is an action area of the UN Decade of Healthy Aging and is embedded in its action plan. Developing age-friendly cities and communities is also a proven way to create more age-friendly environments, as seen through the WHO Global Network of Age-Friendly Cities and Communities, with the acronym GNAFCC, which, as of 2023, had nearly 1,500 members from more than 51 countries, covering over 300 million people worldwide. Despite the consistent growth, GNAFCC has a smaller footprint in low and middle income settings, often due to limited resources and conflicting priorities of people working in public health. At the same time, we know that building the capacity of communities to become more age-friendly so they can foster the abilities of older people can substantially benefit communities in low and middle income settings, while also unlocking innovative solutions that can inspire and support communities from higher income countries. Building age-friendly cities and communities requires action across several sectors, for example, health, long-term care, transport, housing, labour, social protection, information and communication, and more. It also requires action from multiple actors, for example, older people and their associations, support networks and informal caregivers, civil society, international organisations, experts, academic institutions, the media and the private sector. And of course, it also needs action at different levels of government, including national, regional, district and local authorities. I mean, in this context, I'd just like to mention that this is also an area of priority for Thailand and for WHO Thailand. Thailand is one of the most rapidly aging countries in terms of its age structure. And And whilst this reflects socioeconomic development, it also poses some challenges. Again, in this context, one landmark initiative under Thai leadership was the establishment of the ASEAN Centre for Active Aging and Innovation, which serves as a centre for knowledge and innovation. So again, on behalf of WHO, I just want to assure you of our commitment to work in this important area and walk with you as the work gets taken forward. So with that, I will hand back to Tiago. Thank you.
Thank you, Richard. It's excellent introductory remarks, and also thank you for reminding me of the presence of our WHO colleagues from Thailand as well. It's a great pleasure to have you here, as well as everyone that is attending this symposium today, so huge thanks for your presence. What I will do now is just to go through a brief overview of the goals and objectives of the session today, with some practical information on how we will run this event. And the idea here is really, as you heard from Rick, on how we can build on the lessons that of all the innovative work that is already taking place in low and mid-income settings, but also in resource-constrained settings, such as many countries in the region and elsewhere, and how we can foster the collaboration and the exchange throughout the world. North-South, South-South, North-North collaboration, just so that we can benefit from this wider community working towards becoming more age-friendly. So the session will start now. We'll follow with a very brief presentation from my side to set the scene, just to provide a bit more information on where we are at and where we would like to be as regards to this work. That will then be followed by interventions from our distinguished panelists, and I would like to introduce them briefly here. I will not provide extensive bios, but I do invite you to have a look at the app of the conference, and of course to reach out to them bilaterally. Use the opportunity that we have in this event today. We'll start with Dr. Werasak Putsari, which is the Deputy Secretary General of the National Health Commission for Thailand. After that, we will hear from Madame Marianne Tsao, Chairperson of the Tsao Foundation, Singapore, followed by my colleague Quen Tran from HelpAge International, and then our colleague Perak Krui, the Project Coordination Officer for Social Protection with UNDP Cambodia. Last but not least, we'll hear from Prasad Gopal, which is the project manager for creating a dementia-friendly community in Cochin, India. So the idea is that after we hear from our distinguished panelists, we open for a panel discussion, an interactive discussion, both among the panelists and then with the audience. So with no further ado, I will then pass to the presentation. As I said, just to give some brief intros, just to set the scene on where we're at and how we see things evolving, just to kickstart this discussion today. So that presentation, Advancing Age-Friendly Environments in Low and Mid-Income Countries, Challenges and Opportunities for Promoting the Age-Friendly Agenda. And I would like to start by highlighting something that it's not unknown for most of you here, which is the fact that while we have worldwide population aging, it is true that the pace of that aging differs substantially by country. And in most cases, when it comes to low and mid-income countries, that pace is much faster. And that means that while high-income countries had 100 years to harvest on the opportunity, that is to have population living more, these countries will have much less time, 20, 30 years, to address and respond to that opportunity that we face today. Now, it is also true that despite the fact that we have this great success, we are living more, it is also true that we are not necessarily living better. And this is very much the main work that we would really hope to achieve through the UN Decade of Healthy Aging and beyond, which is to close the gap between these lines that you see there, the lines between the life expectancies and the healthy life expectancy. We would hope that every single year lived anywhere in the planet would be a healthy life year lived. Now, one important aspect, a fundamental aspect, I would say, for us to add life to years is precisely the environments that we live in. And by environments here, I mean everything that is outside your body. Everything. The persons you engage with, the physical environment you deal with, the beliefs, the cultural norms, the services, the systems, everything that falls outside your body. And to create an age-friendly environment, we would really hope that that environment enables everyone to age well in a place that is right for them, to continue to develop personally, to be included, to contribute to their communities, and to enjoy independence and good health. Now, it is really important to stress here, and we've seen and heard this in previous occasions in this conference, that age-friendly environments benefit all community members. It's not just for older people. The focus is on the second half of life because we do need to ensure the visibility for that agenda, but it's certainly not something just for older people, because by removing physical and social barriers and fostering inclusiveness and accessibility, we will be benefiting a wide range. Actually, we'll be benefiting the entire population if we do it right. Because by doing this, we will improve accessibility, address gender inequities, helps build resilience of communities for emergencies, and much more. Developing age-friendly citizen communities has been proven and tested as a way to actually deliver on this vision of creating age-friendly environments. Because age-friendly citizen communities, they improve access to key services, and they enable people to be and do what they value through action across the 8 domains that you see in this flower. And this comes after a consultation, a global consultation with older people themselves. They told us on the action, on the domains where a city or community should intervene to become more age-friendly. But more than that, this is also a framework that is being proven to put older people at the center. And this is really important. This is actually fundamental if we are serious about adding lives to years. Now, this framework has been used widely, and what you see here is the map of the global network that Rick has just mentioned in his intervention. But it is also true that if we expand on this map, we see that there's certainly an underrepresentation in many parts of the globe. And in most cases, that falls under a low and middle income country. Now, 5-6 years ago, that was very much the case for Latin America as well. Latin America now, this agenda has really taken up, and it's really clearly a history of success that we would really hope to replicate in many other parts of the globe. And it's not to say that nothing is happening there. It's quite the opposite. It's just to say that I think that the more we can grow this global community and this global family, the better. Who can join the global network? Any city, community, or subnational level of government that is part of WHO. The application is directly on the website. It takes basically 3 criteria, and you see that it's a very inclusive approach. The commitment from the highest political authority, oftentimes we call it a mayor, it varies. The use of a common methodology, which is the methodology I've just detailed, and the sharing. We want the community to be also an opportunity for people to inspire each other. So that's basically what it takes. It's not an accreditation, but it's a commitment to become more age-friendly. Now, I've mentioned the example of Latin America. We've seen that one strategy that is proven to be quite useful to strengthen and expand cities and communities working to become more age-friendly is precisely the development of national and subnational programs. And this is actually a call from the action plan of the UN Decade of Healthy Aging that every single member state develops its national program, and the decade has actually asked WHO to develop a guide to support countries in doing so, which is what you see here. And again, I think this is an amazing opportunity to actually add the additional layer of support for cities and communities that are already working in that direction. And I would like to end this brief intervention by bringing to you one very interesting example developed by my colleagues from the Americas together with AARP and Help Age International. Oftentimes when we talk about developing age-friendly cities and communities in low and mid-income settings or resource-constrained settings, the first thing that comes to mind is, oh, but we don't have money. Oh, but there's a lot of conflicting priorities. There are too many challenges. Well, what this report is showcasing are 28 bright ideas on low cost and easy to implement interventions. So not having resources, it's not necessarily a justification for not doing anything. And I'm sure that by bringing experiences from low and middle income settings, countries, and resource-constrained settings, we'll advance even more on these innovative solutions to actually create an age-friendly environment, whichever we are, wherever we are. So with that, I would like to invite our first panelist for his intervention, Dr. Werasak, who's going to talk us a bit more about examples and the experience from Thailand. Doctor, please.
Thank you. Sawadee krap. Good morning, panelists and participants. My presentation is today is demonstrate what Thailand faced with the aging society and what we have done so far, and what the challenge and opportunity learning from Thailand experience. Next, please. I will start with the graph. Next slide, please.
Do you have?
Oh, sorry. Okay. Thank you. Sorry. That's it. Okay. If you see in the number of this one, maybe the number from different source of data is different, but this picture I would like to say this. If you see Thailand, and we learn from Japan, Singapore, and something like that. It's the aging society, but it's a high-income country. If you see Thailand, we're in the front of the middle-income country with the aging society. That's a challenge for Thailand. We cannot copy, or we can learn directly from Singapore and Japan as well. And we have many friends from the Asian country that we are increasing of the number of the percentage of the older people as well that we're talking about. For Thailand, you see that in the number of this one, 2035, we estimately we have 20% of the people with age 65 and above. You see the rapid demographic transition in Thailand. We see this one. This quite challenge for us. What we have prepare for that one before that one. Situation and challenge in the aging people and older people. Firstly, is the dependencies. We have many the problem with the challenge of the dependency, disabled, homeless, financial dependence, and dementia as well in for the health challenge. From the total household of 22 million households, we found that 6% of the household they have older people live alone, and more 6% we have only older people live together in the family. That's a challenge for us. What we have the challenge, and for the older people, 5% of them is single. There are no family member to take care of. They have to depends on their own capacities. And the challenge in Thailand, you see that the number of the newborn in Thailand from the 98 is more than above millions a year. And now in 2020, we have just only 0.5 of the half of the millions. You see a decreasing of the number of the newborn in Thailand. That's why we thinking of the situation in Thailand is quite challenging for us now. And of course, for the social challenges, we see the gap generation of the X, Y, Z, and Alpha, something like that. It's lifestyle and political. You see, if you heard about the news in Thailand, the political conflict, see a difference of that one, and digital platform change, something like that. And fortunately, if we think of the older people, the concept is the older people is not the burdens. It is a social asset for Thai people. We're thinking of that one. If you see in the pictures, independent elderly, 98%, they can live their own. They have the value, and the productivity of them can continue. Just only 1.6% is home residence, and 0.4% just bed residence. If you see the burden, it's just only this one. For the healthcare, we need a caregiver, nurse, GP, and specialist. It depends on the level of that one. But if you see the big, this one is 98%. We need social community policies. Funding, income earnings, environment support, and daily life activity, and importantly is a group and community events for them to keep them in the socials. We use many platforms to discuss and find a solution together and implement together. For the example, we use the health assembly. Is the specific issue. We have the first one, not the National Health Assembly, the Health Assembly for the aging agenda and policy. The first one, we have the deliberative dialogue on the aging situation and challenge and situation. We come up with the 4 resolution, discuss and adopt a long-term saving, how to have the long-term savings, and group activity in the communities, how to keep it, keeping more the activity, and universal design is environment, especially for the physical environment, and health resiliency and long-term care, something like that. In the 4 resolution, we start working together. The Minister of the Social Development and Human Security in Thailand, he is a key actor to move this agenda to the cabinet and have the action plan for the related agencies working together. The second is just only this year. We have the formal 3 agenda and discuss integrated government budget, integrated service at the local, information integrated of the digital and transformations. You may know that the working style of the government agency, they tend to work with the silo. We try to integrate. We start with the budget first, the budgets and core indicators. And in the local level, we integrate of the service at the locals. We try to link with the national and the local creators, and using the digital transformation as well. The resolution reported to the Prime Minister on the following day is this one. We try to link this platform with the political views to make it happen. And we try to put this agenda to discuss in the social. For the example, we have the policy dialogue on physical security for the elderly and debate among the MP candidate in the general election this year to discuss in the issue. And now we have the national agenda and government policy on the aging society. The cabinet said that they have the 6 sustainability and 4 change and protection and welfare, and this one is the key actor. And we have the try to integrate many ministry to working together for the earning Ministry of Labor, Health, Ministry of Public Health, Environment, MOI in Interior, something like that, and literacy. Literacy is education, something like that. And we have the empower aging, law and regulation, data information, innovative for the equity. This is a national agenda. But importantly, not only the government acting, we have to integrate and collaboration with many sectors. For example, the public-private partnership for the well-being. We have the framework of that one to work together for health, for economics, for the social, for environment and technology and innovation, working together with the knowledge sector, with the political sector, private sector, and academia working together. For the local movement that I mentioned earlier, for the policy, national policy, maybe we have the silo working, but we try to integrate that service, especially for the local and communities. We have now we have 10 provinces. We use the platform of the assembly to discuss and seek agreement of their own province, and learning the platform of the less awareness and making more collaboration among sectors in the province. We have the platform of the sub-district. There we have the platform of the population agenda, community rules, aging society strategy, whatever. Or some sub-district, they use the health charter at the platform of discussion using the aging society agenda. We have the important is we cannot use the single form of the national to work with the different contexts. Respect their own priority and support is important. That our city is try to establish the learning center rather than put the center to work together. And learning, scaling up is not in a number, but for the capacity building, is for the network of the community network and node. Not one size, not fit all, something like that is key. And we use the local wisdom and capital to make their own agenda with some external support when needed, not the external working for them. The key component of learning center is we have a core working group, data information, a platform of sharing, learning, facilitator, and of course the continuous of the activity in the community, and also with the external as well. For my summary is for Thailand is our experience is say that the comprehensive policy, including economics, environment, social, health, using maybe we thinking of the health policy concept to use as a aging policy or the aging policy or the elderly policy is comprehensive one, not only single interventions. The second one is the seeking political views, very important, and social participation and commitment is crucial for that one. Working with the third one is the integrated policy direction and budget at the central level, plus participatory integrated service at local, link the local and national together. The last one is a friendly implementation and learning platform in respect to the local context. Maybe it's the culture, priority, capital, and something like that. I would like to share for Thailand. Thank you.
Well, that's a fascinating example. No? Dr. Warasak started by saying that perhaps what works for high-income settings doesn't necessarily apply to low and middle-income ones. We have a concrete example here on how to organize things. Now, so thank you very much for your intervention. I really liked one comment. In Thailand, older people is not a burden, but an asset. And this is an important message as well. Thank you very much. So we jump from Thailand to the international work, because we have with us Marianne Tal, Tal Foundation. Marianne, please, the floor is yours.
Thank you, Tiago. I can't really say it's international, but I suppose, have the privilege of being a convener of a regional alliance on agencies working for older people. Quite a few of the members are actually here. So I guess I'll speak briefly about from a Southeast Asia perspective. So I think Southeast Asia is actually a collection of very diverse countries, right? There's Singapore, which is where I'm from. There's Indonesia, where the percentage of older people is not huge, but country is very large, so the numbers alone is very big. Of course, you have Cambodia, Laos, Thailand, Malaysia, and so on and so forth. These countries are very vastly different in terms of economic development, the population of older people. Of course, there are big urban and rural differences, something that Singapore doesn't have to work with, but nonetheless, it's actually even more challenging. If you think about following Dr. Wiersek, really, if every country has someone like you, it would be very good. Because clearly, we talk about an age-friendly city. It's really about talking about creating a perfect city for everybody, right? Perfect city for everyone. It's very, very big. And so therefore, there's a lot of things that work on a policy level that perhaps people like ourselves, the CSOs, can advocate for. Making health service more inclusive, making long-term care more available, and making caregivers of younger generation easier. But so all of us, I think, work at different parts. Whether it's advocating for social protection, or whether better health care, whatever, it's all pieces of it. You step back, all those pieces come together to form a part of an age-friendly city or community that's good for everyone. So it's a very, very big area. So as a practitioner, we'll talk about ground up, ground up. So my journey with this City for All Ages, or age-friendly cities, in Singapore they call it the City of All Ages, about 10 years ago. And Singapore is very small. But then at that time, they think even that's too big to think about the government, so it became the whole thing about small is beautiful. We started thinking about the smallest unit of population, 50,000, and trying to make those communities doable. Because as homogeneous as Singapore is, as an example, it's actually still, 7 million people. So, and every community is built different. And we actually kind of think globally about all the theories, all the concepts about age-friendly city, but you have to think local, exactly what worked on the local level. So it started out when they were going from little community to community and got stuck in a third community called Whampoa. It was a very old community, and they said, well, older people don't come out. The hospital complained that they all end up in an emergency room. So what's going on there? So we were asked to start with a survey. And I think this really important point is that you need to know the community you're working with to figure out where to start, because you have to focus on something. Otherwise, it's very, very overwhelming. So that we did a study, and the study included a survey that a lay person can do, basically mostly health and social care survey, and we talked to older people, we talked to some of the stakeholders. And interesting enough, part of the three things we asked was older people, we were told they don't come out, so we asked them, why don't you come out? The answer was, there's nowhere to go. Actually, there was no space for them to gather, as simple as that. And we also found that they don't go to the clinics because it's too far away, and the transportation is poor, so they walk to the hospital because it's nearer. So some things like that, you don't ask you, I really don't know what's going on there. But based on the survey, we also found some starting information. We found that 53% of all older people over 65 in that community were socially isolated. 25% have never seen a doctor, will never want to see a doctor. 17% have significant disability, 10% have dementia. So it's really, if we didn't find those, we didn't ask, we won't know that older people are so socially isolated. And we all know that if you're socially isolated, the outcome is poor. Health outcome is poorer, they have more mental health issues, the mortality is shorter. So we don't ask, we don't know. So it's really important thing to bring up less for me that you just simply have to work with older people and ask, whether a survey, you talk to them, whatever it might be. We also walk around the community to see how useful or not useful transportation and the physical built environment was. And so we basically walked with groups of older people, some in wheelchairs, some in walking frame, and did a kind of environmental audit of what the problems were, where their curbs are too high, where if there's a crossing, the light was too short, simple things. Because changing housing is hard, but changing these small things is relatively easier. And the other thing was that, so other than the physical audit, they also said that, well, what to do because nowhere to go. So we actually found that the most convenient place in the community was this community center. In Singapore, every community is a community center. And the community center, usually the transportation to it's easier because it's meant for a community to come, for all ages. So we're able to convince the local government and local hospital that we should actually put a clinic there. So and the clinic was very catered to the older people with more complex problem, more disability. Because in a way, you kind of have to cater to the ones who have the most difficulty getting health care. And on top of it, luckily for us, we convinced not just put a day center there, also another cafe for people to go. So in the end of the day, so by knowing what the older people wanted and needed, we're actually able to create an environment. But the cafe was very good because young people come too, because we have free Wi-Fi, we have a library, we have newspaper, free food. So they come to drop in. So not just for older people, create a place for older people to come. There's a place for themselves, as well as for younger people to come together. So I think the point is, I want to say is, I think sometimes the hardware thing, like housing, transportation, those are difficult to change. As a matter of fact, we said that the buses don't have kneeling buses. It took 17 years to get rid of all the buses, and now they're kneeling. So it takes time, right? So that the policy level things, big things, the housing stock, transportation takes time. But doesn't mean we shouldn't advocate from ground up. But there are many smaller things that's not hardware, the software. As Thiago said, there are many things can do at a software level, like finding a little space for a cafe, get a community center to open up the space for us to put a clinic there. Things like that could really be done at a very local level in a very small way. So I just want to say that whether or not, from learning from my colleagues in the Southeast Asian countries in the Alliance, is that there are different ways that you can mobilize a community, older people themselves, to make the small changes. The 28 from what Thiago said, we also have a whole long list of things that we can actually do on a community level that work with grassroots and your local government, and older people are very important to make those changes. So that's really the only one I would say. Thank you.
Thank you, Marianne. This is excellent. No, it's interesting because we started by saying that, well, perhaps there are things that we do in high-income countries that don't work in low and mid-income countries. Well, here we have a concrete example of things that do work, right? Start small, start local, start simple, and start with the voice of older people. I don't think that it necessarily means whether you're in a very resource-constrained setting or a very wealthy setting. I'll say that again. Start small, start local, start simple, start with the voice of older people. Thank you very much, Marianne. It's excellent. Now, I will pass the floor to my colleague, Quen Tran, Quen with Help Age International, to present us some of the interesting work around older people's associations. Quen, please.
Yes, thank you very much. Yes, hi, my name is Quinn from Health Age International, and my presentation is promoting age-friendly community through the Older People's Associations, or OPAs, and with a case study from Vietnam. Part 1, OPAs and its evolutions. In the First World Assembly on Aging held in 1982, some 40 plus years ago, the meeting resolution recommended member country to consider supporting the formations of older people's association to promote more age-inclusive local and national development. And through the years, especially in Asia, the number of older people has grown dramatically. Now there are more than 1 million OPAs in Asia, with more than 100 million members. In the country level, they have different names, but they have similar purpose. For the region, we call them OPAs. Through the years, we have used the OPA supermarket. What are the OPA supermarket? So imagine a country, an organization, a person, each has their own cart, and they can go through the OPA supermarket and pick the product they want, they need, and can afford. Now there are thousands and thousands of products that are made by and developed by older people and community for the community and for older peoples. And through the years, the evolutions of OPA has changed dramatically from just being a project-focused OPA, one product, to becoming multifunctional, intergenerational, sustainable, and scalable at national level, becoming low buy-in to very, very, very high buy-in. As you can see here, some example. Vietnam has 100,000 association of the elderly with more than 10 million members. In Thailand, more than 30,000 older people club with more than 4 million members. In the Philippines, more than 20,000 older people organization with more than 3 million members. Sri Lanka, 12,000 with more than close to 1 million members. And this is very old data. Now, it might even more. Next one is OPAs and age-friendly communities, especially in low and middle-income countries. When we talk about age-friendly communities, oh, it must be very expensive. It must be very, very technical. And it's very, very difficult for them to say. So what we have done here is basically, as you can know, the WHO have actually, to promote age-friendly community, WHO has developed an age-friendly community framework which is composed of 8 interconnected domains to help to address barrier to the well-being and participation of older people. That sounds very nice. But when you're in a low-income country, a middle-income country, how can you perceive this? And so here, I would like to give you an example of a country like in Vietnam, how to promote attractive, affordable, scalable, age-friendly community by investing in OPAs. Let's do domain number 1, transportation. The OPA provides support and training to its members how to use taxis, Grab tax, online taxis, motorcycle, cars, as well how to order supplies, shop online, as well as buy the food online. Example, disability access, how to advocate, but also how to promote, fundraise, and construct disability access, promote free bus ID service for older people, and other discount for flight for trains. Also providing free escort volunteers for older people that are in needs. Number 2, housing. OPAs provide a lot of service on housework, cleaning, cooking, repairing and improving housing and communities. House donation, a lot of OPAs promote in constructions of housing for poor families. House protection before the storm come, before the floods, and so on and so, and also advocate for land ownership, usage, as well as ownerships. Number 3, social participation. The OPAs are very strong in this area. Lots of older people are part of older people associations or clubs like that, and they do exercise groups, sport groups, dancing, aerobic, cultural, and hundreds of hobby groups are very, very popular with older peoples. Number 4, respect and social inclusion. OPA provide opportunities to allow young and old to volunteers in the community. They have a lot of social and cultural activities, celebrate birthdays for older peoples, home visits, conducting and celebrating diversities within the communities, within the countries, social care, and also providing personal and health care. In many countries, the OPAs are the largest care provider in the countries. With respect to civic participation and employment, OPAs does a lot with environmental cleanup activities, as well as including in local planning, meeting, and discussions, has huge number of community volunteers in all the countries, and are very active in charity and relief works, provides loans, vocational training, and finding work and employment for the members and others. Number 6, communication and informations. Many OPAs in the region also have OPAs newspaper, older people's newspaper, older people websites and app, older people television shows, as well as also information sharing information in the community through the community loudspeakers, community newspaper reading groups, IT training, how to use the smartphones, as well as home visit, one-to-one sharing. Number 7, community support and health service, providing health awareness through the OPAs, trained by the OPAs, doing health promotions, exercise, sport group, amazing. Health screening, health checkup, promoting health insurance, and also community-based care. Number 8, outdoor spaces. OPAs does a lot of advocacy in working with the local authority to have community spaces, parks, place to sit, benches for wider age-friendly sidewalks, and very large public squares, and they have events, competition, and so and so. And they also are very good at promoting construction of community centers and uses of the centers, exercise and sports, playground, equipment for all ages. So those are the examples. In conclusion, we recommend you to work with and support your national OPA. By doing so, they will create greater and lasting impact. You can reach millions of people with the very limited resources that you have. And it will increase your visibility and credibility of your age-friendly community programs and open up new opportunity for the people, for the government, for your organization, and the private sector to work together to promote age-friendly communities and cities. So thank you.
So thank you very much, Gwen. It's interesting that we see an old mobile to a smartphone. It's really a social technology, what we saw here. It's amazing. Imagine we have 100 million people. 100 million people. This is actually, the WHO Global Network has 300 million people covered. This is fascinating. And one thing that I really liked about Gwen's presentation is that OPAs do a lot, the things that they can do, and the things that fall under the mandate of others, they push others to do. And this is really important. No? We have a colleague from the Global Network that likes to say, nothing about us without us. And this is precisely what we saw here. Thank you very much, Gwen. Now, next presenter will be my colleague, my UN fellow, Perak Krui, who's going to present, show us a bit more the experience from Cambodia. Perak, please.
Okay, thank you so much, Thiago, for such a very warm welcome and introduction. Colleagues, friends, very good morning. So I'm going to talk to you about an intervention that we are doing in Cambodia. It's basically a pilot project that we, together with Health Cambodia, as well as the Ministry of Social Welfare, Veteran and Youth Rehabilitation, also known as MOSUI, we have been piloting in Cambodia in order to respond to the issue and need of older people in Cambodia. So, allow me to begin by sharing with you a quick snapshot about Cambodia's aging situation. Cambodia actually used to be one of the most useful nations in Southeast Asia However, over the past 3 decades or so, the demographic situation of Cambodia has changed remarkably. Back in 1998, for instance, we used to have only 5.3% of the total population who were considered as aging, who were considered as age between 60 and older. However, a decade later, in 2008, that situation has changed. So the percentage of older people in Cambodia has grown to 6.4%. And in 2009, according to the data from our population census, the percentage of older people who age 60 or older grew to 8.9%, which is equal to 1.38 million people. And that is huge. So you can see that there's a trend, and that trend is leaning toward aging. And by 2030, it is forecasted that the percentage will grow even further. By 2030, older people will comprise 11% of the total population. And that did not stop there. By 2050, it will grow further to reach 21%. Well, some sources say 19, but it's still somewhere around there. So you can see this is a problem, something that needs to be done, something that needs to be addressed. Otherwise, we will end up suffering from aging issue. In Cambodia, old people, especially older women and older people with disability, are often considered as one of the most disadvantaged groups. One of the reasons is that many of them are actually suffering from income shortage. Of course, they are doing a lot of work. They are helping with their household chore. They are helping with taking care of their grandkids, so on and so forth. But much of those work is not actually paid at all. So they're still suffering from income insecurity. And some also suffer from health issue and care issue as well. They're not getting the care that they deserve. Some of them are lucky enough to get the care from their family member. But some who are like, when they get old, they live alone. They don't live with their kid. And some of them actually end up not getting the care, and they suffer from all those health-related problems. Others also are seen to have very low level of education, which in turn can affect their daily life as well. And there are others who have not like enough knowledge in order to access rights and entitlement. And others also have problems with inclusion. For example, in general, like the problem of older people in Cambodia, I believe not to be included like sufficiently enough in the policy, in the planning of the government. So still, overall, they're facing such a constraint. Other issues include little involvement from civil society. In Cambodia, it is very unfortunate that not many civil society are actually working on older people. We have a Cambodia who started working in Cambodia since 1992 or 1998, I'm not wrong, my apology. And there are some other, very few organizations that are actually working. Even we ourselves, UNEP, we have just entered into the picture very recently too. And also this problem with a little attention from local community and authority. Not many local government at the subnational level actually are thinking about older people. They might be thinking about it, but the level of involvement of the level of inclusion of the issue and need and demand of older people in their plan is actually not up to the level that it's supposed to be at all. So something needs to be done, which is why we, UNEP, together with Help Age in Cambodia, as well as Mosui, we are trying to implement and pilot a pilot program, also known as a development of an intergenerational self-help model for a dignified life of older Cambodians. It's basically a model that we replicated from Help Age Vietnam, because this model has been implemented very successfully in Vietnam. So we want to see whether or not this model can be implemented in Cambodian context. However, one thing that we try to make it different and adapt to our context is that we try to link this model with religious institutions, specifically pagoda, because Cambodia, for those of you who might not be familiar with that, we are a big Buddhist-dominated country. There are over 5,000 pagoda nationwide, and about 98% of the population actually practice Buddhism. So we see so much potential in linking our OPA, IS16 model, with religious institution, specifically pagoda. So this is the reason why we try to implement or pilot the OPA in Cambodia to respond to the issue and need of older people in Cambodia, because we see OPA as a mechanism that can offer a community-based social protection. So if we implement that successfully, it's going to help the government a lot. It's going to help reduce the burden of the government, because they don't have to rely solely on the national program in order to offer social protection to the people. Because OPA themselves can also offer social protection system, and that can operate at the community level. And also, it can offer a self-help system at the community level, because members of the OPA can, of course, help one another in time of crisis, for instance. And also, the most important thing, this model can operate on very minimal budget. It doesn't have it doesn't require so much budget to be invested in this model. And this is our approach. So our approach is very simple. We try to, of course, replicate the ISAC model from Vietnam. However, we link this with religious institution, especially pagoda, because pagoda actually offer us readily available physical infrastructure that we can capitalize on, and it can offer us a low-cost entry point into this. And also, we also need to integrate with other services like healthcare, because healthcare is also very important in this aspect as well. And in terms of implementation, partner implementer, we, UNDP and HelpAge, are the lead implementer. However, we also find it very important to engage the government, which is Mosubi. So the government also play a major role in offering us coordination and policy support at the national and subnational level as well. And apart from that, we also see the opportunity to collaborate with other important key players in this aging arena, which include WHO, for example. We have seen that the ICO project offers so much potential to collaborate with us in order to improve the healthcare aspect of the OPA. And at the end of the day, we want to identify a model that can fit our context. So when we've done that, we will try to institutionalize and scale it up nationally. So this is a model of Older People Association. I'm not going to get into detail on this because Mr. Tran already explained very much on it already. And these are some of the activities that we are doing in Cambodia. So we start with offering some form of fund to this OPA, like social fund and revolving fund. And this fund will act as the core resource that OPA can actually rely on in order to support their daily operation. At the same time, we also offer them some training on OPA management, training on financial management, and also on income generation activities, so on and so forth. This will be critical for their survival as well. So we offer them training after establishing them. And also we provide them with health equipment and devices so that they can offer low threshold healthcare services to their member. And also we provide home care support. This is also something that we want to focus on in phase 2 of our project. And also we also offer room for knowledge exchange and experience exchange among the members themselves. We organize like a exchange visit among the OPA. And also we try to promote social, cultural, and community services among the members. And last but not least, we also try to revise and prepare a new national guideline on the management and establishment of OPA. Because, like I mentioned earlier, at the end of the day, we want to scale this program up nationally. And for that to happen, it is important there is a national guiding document that can guide the operation and establishment of the OPA. Sorry. Okay, so this is just one example of the pagoda-based OPA that we are piloting. So you can see here the venue that they are using is actually the Buddhist hall. And it's offer free service. Like you don't have to pay in order to use this venue. So it really offers a low-cost entry point for our OPA. So this is all. Thank you very much.
So again, as we see another very interesting example with inspiration from another country nearby, adapted to the context of Cambodia, with low resources, comprehensive coordination from national to local. And one aspect that I really liked about PRAC's intervention is how the smart use of the OPAs to localize some of the guidance, including the guidance from WHO on the integrated care for older persons. How we can use these platforms to localize a lot of the normative guidance that already exists. Thank you very much. Last but not least, I would like to invite to present our colleague from Cochin, who's going to tell us a bit more, Dr. Prasad, on the experience of Cochin in trying to become a dementia-friendly city. Prasad.
Thank you, Dr. Tiago. Am I correctly pronounced? Thank you. So initially, I thought of presenting the statistics, the project plan, components, and all. But being here for the past 2 days, I understood that you are all well familiar with all these facts. And of course, the challenges with respect to the senior citizen are almost universal. So I'll share the experience of my project that will give you an overview about the initiatives at grassroots level, the meaningful participation of older people, and stakeholders and partnership. Now, the age-friendly cities, all things, it's all technical. And it will give you a guiding document or a kind of, framework for implementing the concept of being friendly. But when it comes to the local level, we need to create separate terminology that people can relate with. And here, for every program to be successful, you need a right place. And right place and right team. If you are lacking these two, it is very difficult for us to achieve something we look for. So in this case, we created a platform in a university, Cochin University of Science and Technology, which is in Kerala, India, in Center for Neuroscience. You all know neuroscience basically focus on brain health. But usually they were looking into the biomedical aspects of brain. But is it a unidimensional or one-dimensional view of brain? Is it fully understanding? I mean, will it give a comprehensive idea of brain? No. We have to apply the social science perspective as well, because the development of brain happens in the society too. So we developed this platform for connecting the science and the society. Okay. So, I'm sorry. This is going back? Okay, fine. This is the meaning of Prajna. This is a platform that we use to connect the science and society in the university. Now, we had a lot of discussions, debate, discourses in the center, and we were trying to identify what are the major problems. And we identified that neurodegeneration is a biggest problem that the Kerala state is going to face in the near future. And we understood that it's a big threat to people above 60 years, I mean the senior citizen. And we identified that, if you check the state of Kerala, we have almost 12% of the total population are senior citizen. That means 4.2 million. And they're all facing so many issues, and especially the dementia as a major problem in Kerala, but we haven't recognized it. And we want to address the society with a program. see, the Dementia Inclusive Society framework called WHO came in later. We started this program in 2018, but age-friendly community framework were there. And we wanted to implement this project, but what kind of action or strategies we should adopt. So we had a discussion, and we thought we'll first fix a title. Is it okay? This is the title we have given for a project. We first framed a project, Udbodh, which means enlightenment. And we thought of implementing in a community and with the support of partnership or various partners. See, first, the Center for Neuroscience came into picture. Then we spoke to the university, Cochin University of Science and Technology. We are the initial the players for this project. Then we approached the district administration. We have 14 districts in Kerala, and the district administration are looking for the welfare of people at district level. So we approached them. We told them that there is a threat in the society like dementia, and we are planning to implement a project to address dementia. So the district administration supported us, and the next thing, where we have to implement. So we selected Cochin Municipal Corporation. There are almost 2 million people are living. So we spoke to the mayor, and we shared the issues and the threats that may pose in future, and he agreed that he will support us. And another thing is the crucial point, like Dr. Tiago said, where is the money? We started all these initiatives without any fund. See, all my co-panelists, they are representing big organizations. They don't have a problem of money. Here, it's a university. University is only meant for doing academic work. But when you think about creating something in the society, to approach the society, you have to find your own money. Then we started searching for money. See, whenever we presented the proposal, we have received 2 questions. How long? Meaning, how long these people will live? See, that's a very pathetic question. Second is, what are the benefits? Once you cross 60, you are not, enough potential to support program. So these are the 2 questions, but we haven't stopped there. We searched for fund, and finally we received from a public company about 7.5 million Indian rupees for the project. Still, we knew that we lacking something. So we wanted, we got the support, the technical support from Alzheimer's Disease International, because they have a concept of dementia-friendly communities. But that's at the macro level. But at the micro level, we need to connect the society. We have to get the idea from the grassroots level. What we did, we have conducted an international conference in 2019. See, we initiated people across the world, invited people from across the world, expert and local people also participated. The best part of the conference is that it was free for all. All the people in the community can participate on free of cost. So people from self-help group, women group, senior citizens group, residents association in Cochin, they have participated. Almost 300 to 350 people participated in the conference. The thing is that when it comes to dementia, there is no particular beneficiary group. We are all connected directly or indirectly to dementia. And we have got so much of inputs from this conference, and we updated the strategies and action plan for the project. Second is, yesterday when I was in the symposium, somebody asked about how to connect the younger generation and the old senior generation. Senior citizen. I don't like to use the word older people. That's why I'm struggling. It's senior citizen, no? That is quite acceptable word. So what we did a memory walk. This is a universal program. Every year, September 21st, we do memory walk. In memory walk, we invited people from the school, colleges, all the community-based organizations such as self-help group, residents association, senior citizen forum, Navy, Army, all the people in the society, they have participated, and I think almost 1,600 registered participation walked in the memory walk. I think it's one of the biggest in India, as well Asia. So that way, we got an entry point to the community. We made our point, yeah. So after that, if any Indians are here, they may be familiar with those two phases. They are the film fraternity. We have used their support. And they used their social media to implement our program. Then we have conducted so many awareness programs at grassroots level to the schools, colleges, and everything. And finally, we made the systems. Like, the project was banking on 3 areas: prevention, diagnosis, and care. As the prevention part, we did all the awareness program, education programs at the grassroots level to various sectors. And second one, we did a memory cafe. Memory cafe is an association of people with the dementia and their family members to gather and discuss about their issues and challenges. Then I'll quickly go through. Then we started a memory clinic in the government hospital and in the private hospital. We have prepared the technical document and given to them. Now it's free of course. They are running for diagnosis. And finally, we started a care center. Now that is also functioning well there. And finally, to facilitate all these services, we prepared a mobile-based application. It's called Prajna only. We got support from Tata Consultancy Services. They give us free services. And this application facilitated all the services. And finally, on 16th of October 2021, the Chief Minister of Kerala declared Kochi as the first dementia-friendly city in India. You think that's the end of the story, right? So our part is over. There comes the political will. They understood that this is very important with respect to Kerala, because Kerala is growing like anything. More aged citizens are there. So they came forward and they offered money to us. The state government has given money for implementing a new project at district level, and this is on the halfway. Once it is finished, this project will expand to the state level. What is the difference between Udbodh and Bodhi is that in Udbodh, we just wanted to create a system to test how we can achieve to create a dementia-friendly community. Here, we are doing to prepare a policy document for the state. Because in old age policy, in India, we don't have a separate section for dementia. So we requested for a dementia policy. So we are preparing that policy. And if anyone wish to contribute or associate with us, you are always welcome. And this project is going on now. Yeah, thank you. So everything is available. This is the district, and this is a framework we have made it, and we have adopted the age-friendly city community, framework for this project. These are all the beneficiary groups. We have included everyone. They are almost 2.1 million people are there. We'll cover them by the 3rd year. This is the 3-year project, and this is the final memory work we did. I think this is the biggest in Asia. 2,000 registered participants and 1,500 additional without registration. It is available in the YouTube. These are the programs we have done, police and legal services. We have connected them to support people with dementia. And this is final. You can available. I can see everything in YouTube, our Twitter, Instagram, and Facebook. Thank you.
Well, colleagues, here you have seen a very interesting example from Kochi around dementia. We know that health and social care and dementia is one critical component. There's a huge overlap. And more interestingly is that this is a starting point for the city to advance, because I was just having a conversation with Prasad before, and actually he was saying, well, we are reaching some challenges, because at the end of the day, we can go as far when it comes to housing or to transport or to outdoor spaces. And if we truly want to build a city that is age-friendly and friendly to those living with dementia as well as disabilities, we have to address all these. And in fact, for all the global documents for dementia and disabilities, the age-friendly cities and communities is recognized as a mechanism for us to advance these agendas, given the obvious overlap and synergies there. So thank you very much, Prasad. Now, we have 15 minutes left for an interactive discussion, so I would like to invite our panelists to join us in the table. I have prepared a couple questions here, but I think that, just to kickstart, but I think that at this stage it would make more sense if we open the floor for everyone. I think it's more important that we interact with you now. So please do gear up, get your questions, comments, inputs ready. We already have a hand raised. So let's just wait for the colleagues to settle, and we'll start the interactive part. And thank you very much for all of you for these inspiring and very interesting examples on how to advance age-friendly environments in low and middle-income settings. We have one person there. Just a second, I'll pass the oh yes, thank you. So we have one comment from here and then on the other table, and then should here as well.
Okay, thank you very much for the opportunity, and especially to the distinguished panelists. Thank you for all the information. I totally agree with everything you said. Just a small correction. The aging population in Indonesia is 10%, and in absolute numbers, it is 27 million. We talk about age-friendly environment, especially in developing countries. What is meant by age-friendly is actually friendly for all ages. It's not just for the elderly. It's true, older person can thrive in a friendly environment. They can be independent and even contribute to economy. But people forget, they always look outside. While for me, I always say at meetings, just like charity, everything starts from home. And so much abuse, whether it's verbal or physical, happens at home. Why? And that is the place where they want to be most happiest, where they want to feel secure, where they want to feel safe. Why is there not any study done how to make it age-friendly just at home? And it is because I'm an older person. I'm 80 years old. I work at the grassroots level, so I see what is going on in the home of the families with an elderly person at home. There is so much misunderstanding from the family members or the younger generation or the community about the process of aging that the elderly are going through. Especially as the WHO, UN always says it is good 3 generations under one roof. Definitely. They forget. Older person, slowly they have problems with their hearing, their eyesight, and the children, if they also have children, here comes the conflict. For instance, a grandfather want to watch the television, but the sound must be very loud, and the father will get angry, or the mother. The children cannot sleep because of the sound. So what can we do? So I have proposed that now, whether it's WHO or IFA or Help is International or UNDP, you have to approach the aging process through a life cycle approach. How to do that? Because people always say life cycle approach, but how to do that? So we have actually proposed long ago that the aging process or gerontology should be in the curricula at high school or in college so that the younger generation know what it is to become an older person and what can happen at home when their parents get older. Thank you.
Thank you very much. So I think you touched upon some very important points. The abuse of older people, intergenerational solidarity, and how to educate, how to combat ageism. I think that we could perhaps collect one or two more questions before passing to you. I can do it. Thank you. So, and then we have Shuti afterwards.
Thank you, Theo. Quick question, and taking the opportunity that we have Virajat here who can also deal with this. But taking the experience in the region, what does it take for a good practice and for a sensible approach to scale up at national level? What is the secret of it becoming a policy that is funded and that is implemented?
Thank you. Shuti?
Yeah, I'm Shuti Cho from Taiwan. Thank you all for those wonderful examples, although I happen to miss perhaps two of them. But those are wonderful. But I'm thinking that the success can go beyond what you, beyond the organizations, for example. So I would like to know, for example, Tran, in your experiences working with older persons, what are the major problems you identified that they would like to see to be solved? For example, in Taiwan, in our survey, among the 8 domains, the top one issue our older persons felt most dissatisfying is the opportunity provided for older persons to work. Number one, even if we split into different age groups, among those aged 80 or more is still the second highest one. And the number two is the unevenness of workways. Older persons are so scared to fall. They are still active, but they don't want to fall. That's the number two problem. So in your experience, what are the top problems? And have you tried to, with the voices and power from older persons, to penetrate up to the decision makers and to ask them to do something? Thank you.
So maybe we can start with Gwen.
Okay, thank you. So we have 3 questions. One is intergenerational. So that's why in the whole region we are promoting intergenerational OPAs. So like in Thailand, 25% of the members are young people. In Vietnam, it's 30%. So in many countries now, it's intergenerational older people associations. The second one is how do we promote scaling up nationally? So right now, we're promoting the national scale up of OPAs. So right now in Asia, we have 10 countries that have national network of OPAs. Very strong, very powerful. And if you work with them, it will just add value. It's a win-win-win for you and your organization. And yes, we identify work as one of the very, very popular. Normally it's 1 or 2. In any country, no matter what's in Laos, Cambodia, Singapore, India, or other countries, they are number 1. Social pension is good, but none of the countries is enough. None of them, $10, $20, is not enough. They want to work. And work brings much more benefit than just financial. Much, much more. And we also see the similar things.
Okay, no, not specific question for me, but I would like to add something that for the example of Thailand first. The first thing, I think we use the age-friendly agenda as a social development, not define the way out how to solve the problem of the older people. That's it. For my keyword, I would like to give you some examples. Years ago, we have the agenda of the public space or pocket park or something like that. We use that the agenda for the city development, for the inclusive society, healthy society, walkable city or something like that. We use the elders or the aging-friendly agenda, put it in discussion as well. In many aspects, we can use this agenda to discuss for the developments. Second example from Thailand is you may heard about the village health volunteer, right? The volunteer. This is a strategy is to give them opportunity to show the value of the social contributions. The majority of the volunteer is senior, not older, the senior one. They have the value of the social the contributions, and we try to link with the lifestyle of themselves, because they become the change agent of the health, right? This is a good strategy to keep them more active, to delay of the home returns, bed return anyway, something like that is a strategy for us. I agree with you that we sometimes we start with to have the common group of the senior people because they have common interests, but we try to move it to the intergeneration collaboration to work together, especially for the social event or the social the social activity. We only have them. This is my would like to add.
Okay, just a quick response to some of the questions that have been asked. I think I do agree with you regarding the intergenerational conflict and the approach to life cycle. In fact, in Cambodia, this thing also happened. We have seen cases of son-in-law having argument with their grandfather-in-law, things like that. It happened, and I think it is important that we approach this problem from the life cycle approach. And in Cambodia, we also see this as a priority, and in our pilot, we also try to embed this value and approach into our program. But as so far, we have done only the first phase, so the second phase, we will focus more on that particular issue. And regarding the question on how to successfully scale up the program, I think there are three important things that we need to do in order to scale up successfully. First of all, when we pilot a program, first thing we need to have is concrete evidence of the success that we've done. We cannot go to the government and tell them, okay, this is our program, we need to scale this up, without having concrete evidence. They won't buy in. So concrete evidence is very important. We need to have evaluation of the program, lesson learned, all the key important information, key message that we can use to lobby government and other relevant stakeholders. Second, I think we need to identify the key national stakeholder to lobby. Like in Cambodia, for example, the Ministry of Social Affairs is one of the most important actors in this aging arena, and we have them on our side. But for other ministry, other relevant ministry, like the Ministry of Economy and Finance, the Ministry of Culture and Religion, they are also important partner and stakeholder, and we have yet to lobby them enough. Of course, we have communicated with them, and they also put this into their plan, but we have yet to get their full support, and I think phase 2 for us will be important to lobby them and to show them the concrete evidence so that they can buy in. And third, I think it is important to help a policy document, like the national policy on aging, or make sure that the issue of older people are actually embedded in those national policy on legal framework. With that, all the stakeholders can see that the government has prioritized aging as part of their plan. So I think a key entry point would be doing that, to ensure that the key government policy and legal framework acknowledge the issue of older people. Thank you.
It's kind of hard to add on to that, but I would just say that I agree with everything. No, but I think that the couple issues, I think in terms of how to get the sort of some demonstration project to be duplicate it or replicate it. It's definitely, you have to kind of sell a concept. In our case, we sold it to our member of parliament in the area. And so he gave it endorsement, then grassroots and the local government is much more helpful. You demonstrate it and collect the data and just kick it up all the way. That's important, involve all the stakeholders right from the beginning, from different ministries, the local government, the member politicians, kind of engage all of them from the beginning so they know what you're doing and you demonstrate what you can do and collect the data and then kick it up. So for us, for this project in Singapore, we've been doing it for about almost 10 years, but it's finally getting there, so it takes time. The second thing about work is absolutely, I actually forgot to mention that because that's really the biggest bugaboo that really excludes older people. And older people in Singapore is 50 years old. 50, they consider older worker, okay? Already, they consider obsolete. Because when they train them in the 30s, 40s, the same way they train the 20-year-old, and oftentimes they don't do well because the training method is incorrect. Then they decide they're not trainable. Then by 50 years old, they're obsolete, and then there they go. And if you can't lose your job at 50, the chance of getting another job is almost nothing. And that's even worse for women. When women work and they drop out to take a caregiving, by the time they're 40 years old, trying to get back to work, particularly if they need part-time flexible work, doesn't exist. For years in Singapore, it's like one peak, women working when they're younger, they fall off and they never come back again. So this, particularly the gender, is a major issue because they don't have work and they don't have money for older age. We just started, the ministry actually know that. They just can't move the employers. So the key is after we have to think beyond employment. I think for Singapore, because it's an urban environment, almost everyone looks to get a job by employment. So we end up thinking of other ways. So as I work with employers, we try and do that. But in the meantime, we also try to look at other means like micro jobs, like silver employers, entrepreneurs, creating a platform where market can fund older service provider, things like that. And then it's really it's a long haul, And I think basically we're getting a little traction by working with specific businesses that are dying for manpower. Cafes, coffee shops, places like that where they constantly need workers, and younger people keep turning over, but older workers, also flexible work hour works for them. So we have a few champions in the sort of the coffee chains. So that we also work with some of the nonprofits, work with exclusive hiring processes to do education. So kind of to bring a lot of stakeholders together to try to push something. Thank you.
Regarding the generational aspects, what we have done in Cochin, we identified one school teacher from one school, and we have given them awareness and training about how to take care of people with dementia, especially in that area. And we requested them to have discussion among their colleagues, and the colleague will talk to their students. So every year they will conduct a discussion about dementia. So that way it will go on. And we identified one dementia ambassador from each school. That way it goes. And in college level, we did the same thing, but we invited college students because they are much more elder for voluntary works, and we get volunteers from all the colleges, and they work for people with the dementia. That way it goes. And even there also we initiated small unit clubs. And regarding the sustainability, what we did, the first project what I explained, we have handed over to the Cochin Corporation. If we stick on with the project or we lead the project, definitely it will spoil the overall goal. So we have handed over to the municipal corporation, and we created a monitoring committee which comprises of people above 60 years mostly, that representation from the senior citizen groups and the residents association group, pension associations, people who retired, they have an association. So there is a monitoring committee, and they have more wisdom and they have more power. So they will monitor the project and it will go on. That way the sustainability can be ensured. And other thing is that, we need employment also. See, nobody will come voluntarily to take care of people with dementia. What we did, we started a course on geriatric care, especially focused on dementia. So that way, those who do not have university degrees, they can go for as a professional caregiver, or they can charge for their service. So that way we created employment also. Then when all the system will functions, then only we can ensure that the people will be cared. That way we implemented the program there. Thank you.
So colleagues, thank you very much. I think that we were slightly ahead of the, well, not ahead, behind the schedule. I would just like to end up by saying that as we've seen, we're certainly not short of concrete examples on how to do it, from national to international to regional to very local level. It takes time, as Dr. Marianne said, but if we don't start, we'll never finish, right? It's a continuous journey. So as soon as we start, the better. Please do connect. Let's make it happen. I would like to thank very much each and every one of our distinguished panelists, also your presence. I do encourage us all to exchange, and I look forward to the continuation of the conference on the next 2 days. Thank you very much.